Breast Augmentation After Lumpectomy. The treatment of breast cancer usually involves surgery. The two main options for surgical treatment of breast cancer are mastectomy, which removes the entire breast, or lumpectomy, which removes the tumor and leaves the rest of the breast behind. Mastectomy is typically followed by reconstruction, a surgical procedure to replace the breast. Lumpectomy is usually followed by radiation therapy. In the months and years following lumpectomy and radiation therapy, many patients will begin to notice a difference in the size and shape of the affected breast. The affected breast will typically be smaller due to the removal of tissue and due to the shrinking effects of radiation. The affected breast may also be misshapen or deformed. The resultant asymmetry can be problematic. In order to correct this problem, either or both breasts can be adjusted surgically. The unaffected normal breast can be reduced, and or the affected breast can be augmented or reconstructed. If the deformity in the affected breast is significant, it may need more of a reconstruction type of procedure. It is important to know that in these circumstances, as mandated by federal law, all surgery related to breast cancer is covered by insurance, even many years after the cancer was treated. This includes procedures for symmetry on the non-cancer side. The options for correcting or augmenting the affected breast include using an implant or using the patient's own body tissue. Placing an implant into an irradiated area is fraught with all kinds of potential problems, and therefore using an implant for augmentation in an irradiated breast is not recommended. Also, using an implant has limited value in correcting a deformity of a breast after lumpectomy. Using the patient's own body tissue is called autologous breast augmentation or reconstruction, and this option has many long-term advantages. The patient's own body tissue can be used to augment the breast or correct deformities from radiation and lumpectomy. Autologous breast augmentation and reconstruction, when necessary, is the most effective way to naturally enhance breast size and shape for a permanent result.